Welcome to Georgia's third annual HPV Awareness Day, hosted by the Georgia Cancer Control Consortium and HPV Cancer-Free Georgia. I'm Allison Agnew, Outreach Manager with the Northwest Georgia Regional Cancer Coalition and Tri-Chair of the HPV Cancer-Free Georgia Workgroup, alongside amazing partners like Astrid, Jana, Tahiti, Dr. Bob, and Rana. I'm honored to be your moderator today. Our work group is committed to eliminating HPV-related cancers, including cervical and 5 other cancers, through education, advocacy, and improved vaccination rates in Georgia. This year's event offers continuing education credits generously supported by Piedmont Healthcare and Cancer Pathways. If you're requesting CE credits, be sure to complete the survey that you'll receive at the end of today's session. All planners and presenters have no relevant financial disclosures. And finally, thank you for making the time to be here. HPV is so common. It's basically the group chat of all viruses. Everyone's in it, whether they know it or not. But thankfully, we've got a vaccine to hit leave chat. HPV is the only vaccine that prevents cancer. But with better access to care, screenings, and vaccination, we can prevent nearly all cervical cancers. And that's exactly why we're here today, to raise awareness, celebrate progress, and keep moving forward together. Quickly, we'll go over the agenda. Today's session includes expert speakers, survivor stories, and strategies for HPV prevention. All Q&A will be held at the end, so feel free to drop your questions in the chat throughout. HPV is common, but HPV cancer doesn't have to be. Immunize today. Let's begin with Rana Bayakli, Chief Epidemiologist at Georgia Department of Public Health. She'll be joined in discussion by Dr. Bob Bednarczyk. We all know him as Dr. Bob. He is an associate professor at Emory and associate director for the vaccine policy at Emory Vaccine Center. Rana will walk us through Georgia HPV data and bring in Dr. Bob for insight on the trends and vaccine report. Rana, the floor is yours.
Thank you so much, Allison, and thank you everyone for participating. If we can go next, please. So I am going to go over our HPV-associated cancers. I'm looking at Georgia versus the US, and we're looking at our regional Georgia compared to the Southeast. And then we're looking at our HPV-associated cancer in the state of Georgia. So overall, and the most recent data that was just released in June of 2025, which is the 2018 to 2022, our HPV-associated cancer is significantly higher than the national averages, whether we take combined males and females or females only and or males only. Next. So in particularly, when we look at the specific cancers for the most recent years, 2018 to 2022, we see that Georgia has a higher than the national average for anal, oropharyngeal, and cervical cancers, and very similar to the national average for vulva, vaginal, and penile cancer. You could see that there's a slightly higher, but that is really based on the rounding up to 1 decimal. Thank you. Next, please. So comparing Georgia to the Southeast region, and what this slide shows, year 2021 and year 2022, there are no differences in terms of HPV-associated cancer for the combined males and females. And looking at Georgia, we are in a pool of high incidence rate of HPV-associated cancer. Georgia looks very similar to our neighboring state, South Carolina, North Carolina, Tennessee, and Alabama, and slightly lower than Florida. Next, please. There's a slight differences in terms of females and males. When you look at them particularly, you could see our females on the right side of the slides shows that females in Georgia, HPV associated cancers for female look very similar to our neighboring states, and again, lower than Florida. However, if we particularly looking at males, there seems to be, we're similar to South Carolina, North Carolina, lower than Alabama, but higher than Alabama, I do apologize, and lower than Tennessee and Florida. Next, please. Now, this is our current data. So what I've done in this slide to kind of give you specific look at our HPV-associated cancers, and looking at the previous 5 years, 2017 to 2021, compared to the current years, 2018 to 2022, and what would be released probably next year in June of 2026. 2020 to 2023. So looking at how the number of HPV-related cancers, you can see the first 5 years and the second 5 years, they look very similar. However, the current 2020 to 2023, which is only 5 years of data, and 2023, when this analysis was done, was almost 95% complete. Georgia Cancer Registry, where this data come from, really work heavily on getting 100% complete data. And we have been certified by SEER, the National Cancer Institute, SEER by the CDC, National Program for Cancer Registry, and the National Association for Central Cancer Registries. So our data is of high quality and meets the completeness standard. So I'm pretty sure, looking at this data, that our 2020 to 2023 data is going to be higher than our previous year's data. And you can see we have about 1,000 new cases with incomplete 2023 years. And the majority of this increase really come from anal cancer. It increased in both males and females. Comparing to previous year, we have almost 800 more cases, 600 more cases compared to the previous years. Among males, oropharyngeal cancer seems to be the most common cancer among males in Georgia. And for females, we have cervical cancer being the most common cancer, HPV-associated cancer in Georgia. But looking at anal cancer, it did increase significantly in year 2020 to 2023. And just to kind of remind what Ellison said earlier, that HPV vaccine, if we have appropriate level of HPV vaccination, we are able to eliminate cervical cancer, penile cancer, as HPV infections associate to 96% for cervical cancer and 94% for penile cancer. And we can significantly reduce vaginal or vulvar cancer as they contribute to 80% and 66%. Next, please. So, and this is an interesting slide looking at all HPV-related cancers. Dr. Bob wanted to see this by county, which I appreciate Dr. Bob asking me to produce this by county. This shows that we do have some concentration of HPV-associated cancers in the Northwest, East, Southeast, and South Central, as well as below metropolitan Atlanta. All the counties that are white, it's not necessary that they do not have HPV-related cancers, but in the 5 years, they either did not have 16 cases combined, or they had less than 5 cases, and for rate reliability and confidentiality, we suppress these numbers. Next, please. So this slide, I really would like Dr. Bob input just to go over the slide. You can see this is the big state U.S. Map shows that Georgia have a significantly lower prevalence of HPV vaccination at 40.5%. And for some reason, our female have a much lower rate than male in terms of HPV vaccination, and they are also significantly lower than the national female vaccination rate of 64%. And just in the upper left corner, the HPV cancers kind of compared our current HPV vaccination with our current HPV associated cancer. So if Dr. Bob, if you don't mind, kind of share with us your thoughts on why you think we have a low vaccination rate in Georgia and what can we do to improve our vaccination rate.
Yeah, thank you, Rana. So, it is disheartening when we see these numbers and we see, how low Georgia's, fully up-to-date level of HPV vaccine coverage is. But I think what's important to recognize is that while we are much lower than the national average, in that large map in the center, you can see that we look like many other areas in the Southeast, and in these areas that oftentimes have a lot of rural areas, have a lot of medically underserved areas. There's a lot of issues with access to care. There's a lot of other social determinants of health that are impacting that. We're seeing these impacts on vaccine coverage very, very widely. There's a lot of efforts that have been going on, here with HPV Cancer-Free Georgia. We're the voice of prevention for HPV-related cancers in our state. But we also work very closely with the HPV Vaccination Roundtable of the Southeast, based out of St. Jude in Memphis, where we're looking at, all of these issues of why is vaccine coverage so low in the Southeast, and what can we do to try to improve that? The one caveat that I would say with these data, though, which is really important, is all of these data come from the National Immunization Survey team. It's the annual CDC report that comes out, and while that survey on a national level has a lot of vaccine data on a lot of teenagers, when we start getting down to state levels, the data are fairly imprecise, and you can see these very, very wide confidence intervals around these point estimates here. And we've even seen, decreases in recent years that maybe don't seem to track with other changes that we've seen. Some of that might be due to sampling. And everybody knows I love to talk about data and I love to talk about epidemiology. But we're not going to turn this into that type of lecture. But just to say that, even with some of those potential sampling issues, even with some of the data quality when we're looking at NIS teen, it still has been very consistent that Georgia has been, at the middle of the pack or below the middle of the pack in terms of U.S. states, in terms of HPV-related vaccinations. And that's why we have all of you here today, so that you can hear this data and hopefully that gives you a little bit extra of that push to get out there and work with your partners and if you're clinicians, work with your patients better on trying to promote this vaccine. And that's what we're here for with HPV Cancer-Free Georgia, to provide those linkages and those resources.
Thank you. If you can go next, please. So this slide is just to show you our prevalence, again, using the National Immunization Survey team, that we were increasing from 45 to about 61%. When we were working on our Georgia Cancer Strategic Plan 2024 to 2029, we were looking at our 2022 data, and we were very optimistic that these numbers were going up. So we set our goal to have a 70% HPV vaccination rate by 2029. And then we have that 2023 and went all the way down. So Dr. Bob, what are your thoughts on how can we improve that 40.5% to how can we reach our goal with the strategic plan of 70%?
Yeah, and I think, when we look at this data, what this means to me is that now we're really starting to see the impacts of the COVID-19 pandemic. When NIST collects their data, they're looking at 13 to 17-year-olds for vaccines that are routinely recommended between ages 9 and 12. So there's a little bit of a delay in there. And so the numbers that I think we've seen maybe in 2021 and 2022, while that was during the time of the pandemic, that also, you had a lot of kids that might have been vaccinated before that. Now, I think what we're starting to see is those preteens and teenagers that may not have had the opportunity to get vaccinated, due to, access issues during the pandemic, or have, we might have seen decreases in vaccine confidence as a result of the COVID-19 pandemic. So I think this really should be a wake-up call to us, to again make sure that we're having good conversations with parents, that we're doing the outreach that we need to do. I'm looking forward to one of the later speakers today. Some of our survivors, our HPV-related cancer survivors, because I think those stories are so important. I mean, we can talk about numbers all day long, but those stories are really, really important. And hopefully you can take those stories back with you. But again, remember that we're here as that resource for you, in terms of information, education, materials, and support, because we all need to pitch in together to address this. But it really comes down to how we can do that outreach and how we can do a better job talking with our communities and with our patients and everybody that we work with.
Thank you. Next, please. So this next slide is just to show you, this is another publication that was produced at the national level showing that our HPV vaccination for the nation has been flat since 2021. Next, please. And the last to share with you is that HPV vaccination is one of the lowest vaccination rate compared to other vaccination. So just Dr. Bob, would you want to share more? And this is promised, this is our last slide to discuss.
Yeah, and very briefly, as Rana said, HPV is much lower compared to other vaccines. And I think that's important because it means that these same kids are going into the doctor. They're getting their Tdap vaccine. They're getting their meningitis vaccine. So we need to roll HPV vaccination into all of that, offer all three of the vaccines together, really make sure that that's part of our communication and our outreach and our vaccine recommendations. But I think most importantly here, again, even at the national level, you can start to see in the kids that were born in that time period that would have been most impacted by COVID, that's where now we're starting to see those drop-offs. And if we don't come together to really get HPV vaccination back on track, we're going to lose the gains that we've made over those previous years, even lagging behind other vaccines. We have seen increases. And this isn't the time to step back. This is the time to step forward.
Well, thank you so much. Next. Thank you so much, everyone. And as Allison said, we will take our questions at the very end.
All right, thank you.
Thank you.
Thank you, Rana and Dr. Bob, for that thoughtful and important discussion. Really quickly, next, we're going to do just a quick poll. So please take a moment and respond on your screen. Okay, so hopefully everyone's had time to complete their pre-webinar poll. So next we will back into our presentation and our discussion for today. Next, we're going to hear from Dr. Baldwin. She is going to be sharing a story from a survivor. His name is Tommy Smith, and he has generously shared his HPV journey with us. His story highlights not just the clinical side of HPV, but also the deeply human impact.
Thank you so much, Allison, for that introduction. It's my pleasure and honor and privilege to be here to relay a good friend of mine's story. His name is Tommy Swift. We actually grew up together in South Georgia, Albany, Georgia, and we graduated from down there together in 1988. And while he found some papers of things we wanted to do, that we had written in high school and recently relayed those to me, I did go into science. I didn't know that I was going into HPV research at that time. And Tommy certainly didn't know that he would be developing a cancer due to HPV later on in his life. This is Tommy, and this is his lovely wife. Next, please. So Tommy wanted to relay his diagnosis, some important things about his surgical treatment and recovery, as well as his chemo and radiation therapy that he experienced, and post-treatment side effects and how he's adapted. Next, please. And the diagnosis of this type of cancer, it can be really subtle. So it's important to understand what to look out for. Next, please. So recognizing those initial symptoms, this is Tommy's lovely daughter, and I'm going to read how he found this out. These are his words, his story, his voice. I was truly lucky how I was able to discover the tumor in my neck. Our family made a trip to New York City during spring break to check out colleges for our daughter and try out for the Rockettes. After coming home, both kids had colds and sore throats, and he jokingly looked and checked lymph nodes to show them that he was fine. Instead, he found a hard mass, and he followed up really quickly. Now, as luck would have it, he was able to get in to see his physician, who quickly referred him to an EMT, and she was able to quickly schedule a biopsy for that next Monday. And knowing Tommy, he actually had a perfect attendance score. So he was never out a day in high school for being sick. And I remembered this as I was looking through his story very fondly. Next, please. And so his diagnostic test, the biopsy he underwent, the imaging, and the HPV typing all came back. And it was really strange for him, he's relayed, because you think about things happening to other people. You hear about things happening to other people, but when they happen to you, it's quite a different situation. And his cancer was due to HPV. Next, please. And so this is a picture of Tommy before his surgery. And receiving a cancer diagnosis for me was like hearing a diagnosis about someone else. You hear it secondhand. He spent his childhood and adult life relying on doctors. And so Tommy went through his informed decision-making process, was reliant on his physicians and care team to take care of him. Very vulnerable position to be in. Next, please. So his surgical treatment and recovery, next please, he actually had to have more treatment than he thought. The surgery went well. He was postoperatively monitored, and he was on pain management regimens. And the early physical therapy was relegated to speech therapy because he was even told he needed to learn to swallow again. Next, please. And the recovery process and initial challenges, he shows some of his pictures throughout this process here on the right. Regaining his strength in his throat and jaws was a very long road, and the post-recovery normalcy was also an interesting process for him. Next, please. The chemotherapy and radiation, next please, was a surprise for him. He had no idea about all the different types of chemotherapy drugs, so there was a lot to navigate there. And that supportive care was super important from him, for him, for his family, his friends. And you can see his son up there in the top row of pictures, him attending his daughter's graduation on the bottom. Next, please. And he also has pictures of receiving that radiation treatment. And his therapy schedule was for 33 treatments over the course of 7 weeks. He experienced many side effects. And the coping strategies and why he's not here today, I love this for him. He needed to practice physical self-care, set boundaries. It's actually his wedding anniversary today, which is why he couldn't be here in person with us today. But stress management was also big for him. He had to remind himself that he can only control the things that he can control. Next, please. The post-treatment side effects also took some time, acute and long-term side effects, which he's still experiencing. He even needs to still put on a pullover or a jacket because he's constantly cold, and he constantly works on that neck and facial muscle tightness. Next, please. The lifestyle adjustments, nutrition he talks about is so important for his recovery. He had lost weight that he was happy to lose, but he wanted to make sure that he was doing everything in the most healthy way and to include exercise and stress reduction. Next, please. And Tommy, as he has always said, is an open book. So he is sharing his email address here for you for any attendees who would like to contact him if you have any questions or requests for further survivor support. He is open to it. Thank you so much for allowing me to relay your story, Tommy. I love you to death, and I'm so happy that you're in recovery. Thanks, everybody.
Thank you, Dr. Baldwin. Data can tell us the what and the how, but survivor stories, they tell us the why. They remind us that behind every statistic, it's a real person. It's a parent, a friend, a coworker, someone whose life was completely changed by HPV. We're so grateful to Tommy for sharing his story with us and for his courage and honesty and willing to speak out. Next, we'll hear from Jeannie Fitzpatrick. She's a nurse manager at Augusta University and the UGA Medical Partnership Teaching Clinics. Her presentation, HPV Immunization Through a Patient-Centered Lens, will walk us through respectful, empowering approaches to vaccination. Welcome, Jeannie.
And I'm a nurse of 21 years with a specialty in labor and delivery, legal nurse consulting, and a sexual assault nurse examiner. And you may be wondering, what is a labor and delivery nurse doing here? And I am going to be the first to admit that I'm not an expert on HPV immunization, but what I do know is patient-centered care. So today I'm going to focus on HPV immunization through a patient-centered lens and what that looks like in practice. And I have no financial relationships to disclose for this talk today. So what is patient-centered care? It's really a lens through which we can view everything we do in clinical practice, including procedures that feel very routine to us as healthcare providers. It's an approach that ensures we are respecting autonomy, getting informed consent, and promoting shared decision making. Patient-centered care is really a way of getting away from that assembly line healthcare where everyone with this diagnosis gets this treatment. Instead, it promotes individualized care where we can share information and education with patients so that they can be an active participant in their care. Now, looking at HPV immunization, there's a lot of really good reasons to immunize. This immunization provides long-lasting cancer prevention, and the science tells us that it's safe and effective. It protects against 6 cancers and genital warts, and we have over 15 years worth of data that supports the benefits outweighing the risks. Just as a refresher, this is the typical schedule for the HPV immunization for those without contraindications. Of course, always refer to a trusted source for the up-to-date vaccine schedule. The CDC and the American Academy of Pediatrics each have guidelines, and they seem to not agree on everything, but they do both currently acknowledge that HPV immunization can begin at age 9. And age 9 is currently the recommended starting point by the American Cancer Society and the National HPV Vaccination Roundtable. This is a time when we can do a lot of education with parents that gives them information they may not realize that they need. Parents might not realize that the series starts at age 9, and according to the National HPV Roundtable, starting it at age 9 improves efficacy by giving a greater immune response. So just recognize that when you're bringing this topic up with parents, it may be something that they haven't thought about before. So they may need a little bit of extra time to kind of digest what you're teaching them. As in most things within healthcare, nurses have a really important role in patient-centered HPV immunization counseling. Nurses are very skilled when it comes to patient education, empowerment, and providing support. Now, it's great if you already have a trusting relationship before you discuss HPV immunization, but just know that the way you approach this topic can actually be an important component in building that trust further. In a patient-centered approach, we don't want to coerce or pressure. We want to respect autonomy and encourage open dialogue and questions. Some of the key things to keep in mind when talking with parents is going to be safety, health, and why the HPV immunization is important. You know that safety is the first thing on a parent's mind, and they want to do the right thing for their kids. It's important to use clear communication and be direct in saying, I'm going to give you honest information about the HPV immunization so that you can make an informed decision. Acknowledge that they are the best person to make decisions for their child and that you want to support them by giving them honest information. Ask open-ended questions and assess what they already know or have heard. That can really help tailor your education to meet their needs. Now, I'm talking a lot about autonomy and respect and avoiding coercion, but I do want to point out that in a patient-centered model, you can still make a strong recommendation, but the approach needs to encourage respectful and thoughtful dialogue. Empowerment and prevention really go hand in hand. And by being honest and being a safe space for them to ask questions and providing them with fact-based information, you're empowering them to make an informed decision about the health care of their child that can have a lifelong impact. I also can't stress enough how important interprofessional collaboration is. We all have an important role here, and having consistent messaging among your team is key. We all have a shared goal, whether it's nurses, public health team members, physicians, scientists, pharmacists. The list really goes on and on. And I always love the phrase, it takes a village, because it's so true in so many aspects of what we do. And in this case, our shared goal is to prevent cancer by supporting and empowering parents and patients to make informed decisions. Some of you may be asking yourself, how do we deal with the misinformation that's out there while leaning into a patient-centered model? There are certainly a lot of myths out there, and I've just listed a few of the common ones here. I would say the best thing that we can do is listen and empower our patients or parents with facts. Be the provider of evidence-based information. Respect their concerns and don't be afraid to share what the science tells us and what your experience has been in clinical practice. You are a trusted source of information. And in a world where everyone can decide to be a health influencer on social media, be the one that they feel comfortable coming to fact check. And that all comes from building relationships and using a patient-centered approach. So I hope the big takeaways for you today are that relationships and trust are key factors in HPV prevention. We want to lead with empathy, respect autonomy, and encourage an open dialogue. Be prepared to address the common myths with respect instead of judgment. And just remember that you're a trusted source and that patient-centered approach is really an opportunity to build trust and empower our communities. Thank you so much for your time, and I hope this was an interesting topic that you found useful. My contact information is listed here. If anyone wants to reach out to me, you are more than welcome. And here are my references. Thank you so much.
Thank you, Jeannie. Our final speaker today is a good friend of mine, Jennifer Alexander. She is a powerful advocate and 4-time cancer survivor. Jennifer is a native Atlantan and has worked as an administrative assistant for an insurance company for the last 12 years. And in 2019, she became the focus of medical research at Emory University after being diagnosed with tongue cancer for the 4th time. Rather than let that stop her, Jennifer faced the challenge head-on. She's since turned her focus to education and advocacy, reaching out to fellow patients with head and neck cancers and providing support through shared experience. Jennifer, thank you so much for being here with us today. The floor is yours.
Thank you. Thanks for that introduction. Thanks for being fine as well. You can go to the next slide. So my story is a little bit different. I had my very first biopsy for tongue cancer in the 90s. The 90s, when I was diagnosed with HPV. I didn't really know what it was at the time, so I just like, okay, whatever. And then not long after that, I had my first biopsy. I continued to have biopsies, a lot, like every 6 months for years and years and years. So finally in 2009, it turned into full-blown cancer, and I had just like a tip of it taken off. You can go to the next one. And this is after the 3rd. You can see it's weird looking. It looks like a comma. We used to kind of make fun of it, but they just kept taking more and more off. Now, luckily, I'm 20 minutes away from Emory, and someone recommended Emory, so I went there. Dr. Boyce and Dr. Patel literally saved my life. I would not be here without them. And I believe that the HPV cancers can be stopped, should be stopped. And I think we just have to use our voices to get that out. And I still do a lot of HPV advocacy too. People, come to me, even though I'm not a doctor, I'm a tax accountant, for, advice and education. If I had had that vaccine, I would not be sitting here today. I would not have had cancer. I think I had tongue cancer in a time when really no one knew what it was. So in 2019, I went to, and you can go to the next one. So I went to Emory and had the surgery. I was literally terrified. I did not know exactly what was going to happen, but Emory actually hooked me up with some survivors that changed the game for me, because I called this the lonely cancer because no one had tongue cancer, and I was young, I was 37, and I was terrified and afraid. And then I come to Emory and meet all kinds of people, both men and women, old and young. I went viral on TikTok with one of my stories, or a version of my story. And I still, to this day, even yesterday, someone reached out to me yesterday. Her dad was currently in the hospital having the surgery, and she was scared. And so I gave her my best pitch. And I think it's important to see this side, because people think they're not going to be able to talk. They think they're not going to be able to eat. And that is the case in some cases. But eating is still difficult, and talking sometimes is still difficult. But I'm here and I'm thankful, and I could not be more thankful to Emory and to you guys for raising awareness on HPV and HPV cancers. I think we have to take the stigma out of it. I had one of my really good girlfriends' aunt died in silence due to humiliation of having HPV cervical cancer. And I swore then that I would sit beside anybody and everybody that needed me and wanted me to, because I don't want anybody to be alone in this. It's not fun. It's definitely not fun. But there are some positive sides to this. Cancer teaches you a lot about yourself, about the people around you, about what you want from life. So I'm just thankful. And I'm glad I can talk. I think my biggest thing I wanted to do was be able to sing in the Miranda Lambert concert. And I do it loudly. So I am happy, and thank you for having me. And go to the next slide. These are just all of the skin grafts that they took. So they made a tongue from my left forearm skin, and that has a tattoo on it. You can go to the next slide. You can kind of see the tattoo here. So they took the skin from my forearm, made a tongue, took the skin from my thigh to put over the arm thing, skin graft, and that was cut from ear to ear to take out these lymph nodes. Because I had cancer so much, they took out all the lymph nodes. So the scars from ear to ear, but you really can't see it. I still deal with lymphedema. I actually used my lymphedema machine this morning because of the scar and having the lymph nodes. The fluid in my face doesn't drain out, so it stays pretty swollen. And I have to do, PT massages, the machine, and all that stuff. But it's a small price to pay. And thank you so much, y'all. And if anybody has any questions, I will take them, or about anything.
Thank you so much for bravely sharing your story, Jennifer. Your voice carries strength and hope and healing, and not just for those who are directly impacted by HPV, but for every person who has ever felt silenced by stigma. I know that your words are going to stick with so many of us today. So next we'll begin our Q&A session. If you have any submitted questions, we can read those aloud and allow our speakers to respond. So if you want to drop something in the chat box, feel free. Okay, Jennifer, we've got a question for you. For Jennifer, what advice can you give to medical professionals working alongside people during their cancer journey?
I would say first, give him my number. There's nothing like support from someone who's been through it. medical professionals' advice, I mean, I think transparency is super important here. I think that what's going to happen to you after is probably, and some people don't want to know, but some people do. I think just being transparent and educating the patient.
Thank you. We have another question. Let's see. I think this one probably go best to Dr. Bob. Is there an age gap or an age cap on the vaccine?
Yeah, so right now, the main part of the recommendation is that it's routinely recommended for everybody ages 9 to 26. There's, there used to be some differences by sex, but now it's sort of uniform across the board for, routine vaccination, routine catch-up vaccination through age 26. And then through something called shared clinical decision-making for 27 to 45-year-olds. And that means that if you're in that age range and you haven't previously been vaccinated, you can talk to your doctor and assess the level of benefit and, how much is it going to, potentially be good for you. The nice thing about that shared clinical decision-making recommendation for ages 27 to 45, though, is that is still an ACIP recommendation, which means that insurance coverage will be triggered by the Affordable Care Act. So those doses, if you do get them, should be covered by insurance as well.
Wonderful. If we could bring in Rana for this next question. This one is for Rana and Dr. Bob. What HPV-related cancers are becoming more common in men?
So based on the data that I shared earlier, it seems like oropharyngeal cancer is the most common cancer among men in Georgia. And what's next is anal cancer that seems to be increasing.
Thank you, Rana. Here is a really good question. Rana, this one could be probably for you as well. Are there any studies done on comparison of HPV uptake by parents when HPV is specifically called out and education provided versus just offering the HPV vaccine in a bundle of other childhood vaccines?
Are you asking me? I'd rather Dr. Bob respond to this.
Okay.
Yeah, I can take this. So this is something that I think we're paying a lot more attention on, especially with the, a lot of the emphasis recently about trying to start HPV vaccination at the first opportunity, which does mean that it can be started at age 9. That does take it out of that bundle of the other adolescent vaccines, the Tdap and the meningitis vaccine that are also recommended at ages 11 to 12. We've seen when those recommendations are given for 9 and 10-year-olds that there does seem to be, a little bit more acceptance of the vaccine in there. But really, I think the biggest thing is if you're going to be bundling it, keep that bundling because it doesn't call HPV out as its own special vaccine. It doesn't give it that, that sense of, oh, there's something different about this, having that bundle in there. But if the bundling isn't working and you start going down to starting recommendations at ages 9 and 10, that can be useful. And in that case, that recommendation will be on its own. So that may, spur a little bit more conversation or some more questions about HPV specifically. But again, I think that's something where, the resources and support that we have through our working group and through, other roundtables at ACS and the roundtable of the Southeast, that we can give some support around that as well.
Wonderful. We'll take one more question and then we'll move along. One of our participants, this is actually for Jennifer. He says, this is a silly question, but I'd like to know if the tattoo from the flap donor site is still visible on the tongue.
Sorry, y'all, I was muted. It definitely is. I thought it would be in the back of my mouth, but it's front and center. I can show it if you want to. Some people would get weirded out by it, but I can show it. It's definitely you can tell what it is. There, it's a star. I got it with my cousin 20 years ago. I tell people all the time now to Be careful where you get your tattoos. I can also, the biggest question I get too is, can I taste? And I can. It's different, but I can.
I love that, Jennifer. Jennifer and I, we actually graduated together, and my favorite part of graduation was telling everyone that I made a friend with a girl, and she had a star tattoo on her tongue, and I think that that's super cool. So next we'll launch our final poll. It should pop up on your screen. So just take a few minutes to do that. Okay. It looks like I'm sorry, I think I missed one question. We have one other question that I skipped over by accident. Let's see. Are there any strategies related to reducing stigma that have provided best results?
I'm going to try to answer this just from my perspective. I feel like just telling my story and being open. I mean, when I'm at Allie, you said, I can't believe you're admitting it, because no one does. And I'm like, I do that on purpose so that it puts them at ease. I used to ask survivors if they had HPV, but I don't anymore because they're too embarrassed to admit it. But I think just telling the story and letting people hear that it didn't break me. I'm still here, and you can't say anything bad about me, so it's fine. I don't care. I think it's just showing people this is there's nothing to be embarrassed of.
Thank you, Jennifer. Can we go to our next slide, please? Okay, so quickly, this is just about claiming your CE credits, but that's important if you need them. They're provided by Piedmont Healthcare and Cancer Pathways. Please take a screenshot of this with your computer, or grab your phone and take a screenshot because you'll need the activity ID in order to receive your CE credits. It tells you what to do. You create a little account, visit the website, log in, go to My CME, claim credit, and enter activity ID 16157. The deadline to claim the credit is Thursday, July 24th at 11 a.m. So make sure that if you need these CE credits, save the activity ID, take a picture of it, and then go ahead and fill all this out and create your account and everything, so that way you can get credit for it by July 24th at 11 a.m. If you have any questions, you can email cloudcmehelp@piedmont.org. Thank you again to everyone who joined us today. If you'd like to stay connected or get involved with the HPV Cancer-Free Georgia Work Group, we would love to hear from you. Please reach out to Dahidi Dola at ddola, it's DDOLA at gsu.edu for more information and opportunities to collaborate. A big thank you to our incredible speakers, the Georgia Department of Public Health, the GC3, the HPV Work Group, and of course, the ad hoc subcommittee for all of your hard work in making today's event possible. A lot really does go into this. And so we really appreciate you guys and all the extra time that you put into this to make today possible. Thanks again to all of our wonderful speakers for sharing your story and for your bravery and for educating us today. We've got the science, we've got the strategy. Now we just need the voices and the vaccines. So go out and be loud about prevention because silence never saved anyone. Have a great afternoon, and thank you for helping lead the charge in your communities.